Welcome to the Community Outreach Lab, Introduction to Ergonomics, through the Department of Health and Human Physiology at the University of Iowa. Ergonomics is defined as an applied science concerned with optimizing efficiency and safety of interactions between people and systems. In health and human physiology, ergonomics can be applied to our daily lives to ensure safety in the movements we make. Whether you work a labor-intensive job that causes strain on your body, or you sit at a desk for long periods of time, for work or in school, ergonomics can benefit productivity and efficiency in every workplace.
There are many benefits to participating in ergonomics on a daily basis. Posture plays a large role in our daily lives, and practicing ergonomics can improve overall posture and substantially decrease your risk for musculoskeletal disorders as well as nerve disorders like carpal tunnel syndrome. Ergonomics can also reduce pain in your neck, back, wrists, hips, and knees. Additionally, practicing ergonomics just a few times a day is linked to improved productivity and overall physical comfort.
We can often find ourselves subconsciously practicing poor posture in our everyday movements. When we're standing, for example, we usually have our back slouched with our shoulders and head leaning towards what we're looking at. Or when we're sitting at our desk or looking at our computer, our head hangs and our shoulders slouch, often without our feet flat on the floor or our core engaged. And when we look down at our phone, lots of strain is placed on our neck when we hang our head down. To fix this, we can roll our shoulders back and hold our chin high to align our back in an upright position. Keeping our core engaged to hold ourselves upright is also important. When looking at our computer or phone, if we bring what we're looking at up to eye level, we can reduce the strain on our neck and the hunch in our back by looking at them straight on. Maintaining good posture will help improve our blood circulation, keep our nerves healthy, and support our muscles.
Ergonomics includes stretches and movements that exercise certain muscles and joints throughout the body. To demonstrate this, we'll show you how to target specific areas of the body so you can learn and practice these movements. There are many exercises for each region, but we'll go through multiple movements targeting specific areas of stress in the upper and lower body.
Our first two exercises will be focusing on the hands. For the first, called thumb work, make a thumbs up with one hand and extend that arm out in front of your body. Then, using the other hand, gently pull your thumb towards your body and hold for 30 seconds. Make sure to repeat with the opposite thumb. The next hand exercise is called cat claws. Start by making a tight fist with your hands and then opening your palms and extending your fingers as far as they can go. These next two exercises will target your wrists. Begin with your palms together in front of you, making sure your elbows are also touching and your hands in front of your face. Then, while keeping your palms together, slowly separate your elbows, lowering your hands down to your stomach, and hold for 10 to 30 seconds. This exercise is called prayer hands. The second exercise for the wrists is called clenched fists. To do this, start by sitting in a chair with your feet flat on the floor and place your hands on your thighs with your palms facing upwards, making sure your forearms are also resting on your thighs. Then slowly clench your fists without tightening them too much, keeping your forearms on your legs, and raise your fists off your legs towards your body. Hold for 10 seconds. Moving on to shoulder exercises, we will begin by practicing shoulder rolls. Make sure your back is straight and your arms are relaxed, and slowly roll your shoulders forward 10 times and backwards 10 times. The next exercise is called overhead shoulder stretch. To do this, extend your arms above your head and interlace your fingers with your palms facing up. Then push your arms backwards until you feel mild tension in your shoulders and hold this for 10 seconds. Next, a few exercises targeting the neck. We will begin with head tilts. To do this, keep your chin tucked in towards your chest and gently lower your ear to your shoulder. Hold your head in position for about 10 seconds and repeat on the other side. Another exercise to reduce neck tension is head turns. Begin by sitting or standing straight up and turn your head 90 degrees to the side or as far towards your shoulder as you can while keeping your shoulders straight forward. Hold this position and repeat over the opposite shoulder. Our next two exercises focus on relieving stress in the chest. The first exercise is called pectoral stretch. To do this, begin by raising both hands to the sides of your head and bending your elbows. Your palms should be facing forwards. Then pull your elbows back to slowly bring your shoulder blades towards each other. Hold this for about 10 seconds. The second chest exercise is called behind the back grip. Begin by bringing your arms around behind your back and touching your palms together with your fingers touching the inner wrist of the opposite arm. Slide your palms forward, along your forearms, towards your elbows or as far as you can, and hold for 10 to 30 seconds. And now some exercises that target the back. The first is called upper back stretch. Begin by standing straight up, shoulders back, then interlace your fingers and turn your palms upwards above your head, fully extending your arms. Slowly lean from side to side. The second exercise is called back arch. Make sure to stand up straight, and then while supporting your lower back with your hands, gently arch backward and hold for 5 to 10 seconds. To make sure your neck is following your spine, look upwards as you hold this stretch. The next two exercises will target the hips. The first is called sitting stretch. Begin by sitting in a chair with your feet flat on the floor and your back straight. Then place your right ankle on your left knee and lean your torso forward until you feel tension in your hip. Hold this for 30 to 60 seconds and repeat on the other side. The second exercise for the hips is called piriformis stretch. Start by sitting on the floor with your legs extended out in front of you, then cross your right leg over your left, bending your right knee and placing your foot flat on the floor. Place your right hand on the floor behind you and your left elbow on your outer right knee. Finally, push your right knee left with your elbow while twisting your torso to the right. To modify this exercise, you can use your hand instead of your elbow for leverage while twisting. Hold this position for 30 to 60 seconds and repeat on the other side. The next two exercises will target the legs. The first is called seated back curl. To do this, begin by sitting at the front of a chair with your feet flat on the floor. Then slowly lift and bend your leg to grab your shin with both hands and pull your leg in towards your body. If able, try touching your nose to your knee for a deeper stretch in the legs, and repeat with the other leg. The next exercise is called seated leg lifts. To do this, begin by sitting at your chair, feet flat on the floor, back straight, and straighten one leg and raise it as high as possible without bending the knee. Hold for 10 seconds. You should feel a stretch along the back of your knee. Our last two exercises will focus on the ankles. The first, called ankle circles, begins with sitting in a chair with your feet flat on the floor and back straight. Place your right ankle on your left knee and turn your ankle equal amounts of times to the right and left. Make sure to isolate the movement to your ankle rather than your leg. The second exercise for the ankles is called Achilles stretch. Begin by standing in front of a wall or behind a chair and place your hands on the wall or on top of the chair for support. Step your right leg one step behind your left and keep your right heel touching the floor while bending your left knee until you feel a stretch in your right leg. Hold for 15 to 30 seconds and repeat on the other side.
Now that you've seen some ergonomics exercises, you can begin to do them on your own. You can refer back to this video for live demonstrations or refer to the Health and Human Physiology Exercise Library for more detailed descriptions of each exercise, as well as additional resources like our detailed PDF. It's important to know that there are no set guidelines for practicing ergonomics. You can use as many of these exercises that you want or feel that you need. And remember, the exercises you do should be specific to your body, your needs, your everyday movements, and your problem areas. What you practice should help you, not hurt you. Thank you for watching.